University of Florida's pioneering Virtual Experiences Research Group. The University of Florida Virtual Experiences Research Group, VERG, is a research lab within the Department of Computer and Information Science and Engineering at UF. It was founded and is directed by Dr. Benjamin Locke, a professor in the SCIENCE department. VERG focuses on using virtual reality, virtual humans, and related technologies to enhance training and education, especially in healthcare fields. The lab creates a variety of virtual patient simulations, clinical interviews powered by conversational AI, and other innovative learning experiences. VERG partners with medical schools and hospitals to incorporate these technologies into their curricula and assessments. The group has a multidisciplinary team spanning backgrounds like computer science, psychology, medicine, and engineering. VERG has received multiple Best Paper awards at academic conferences recognizing their research. Their current projects relate to improving clinical communication skills, empathy training for providers, eliciting health behavior change, dysphagia assessment, triage training, and more. In the past, they have worked on topics like addressing pain assessment biases, enhancing emotional self-awareness, calibrating trust in simulations, developing augmented reality training tools, and other areas. The lab collaborates with other universities and research groups around the world. VERG also has an extensive record of publications in venues like IEEE VR, IVA, ACM SIGCHI, and various medical and healthcare-focused journals. In summary, the University of Florida's VERG is a pioneering lab that develops advanced VR and AI training tools, with specialized expertise in healthcare education. Benjamin Locke. Benjamin Locke is an accomplished professor and researcher directing the pioneering Virtual Experiences Research Group at the University of Florida. As the founder of this lab within UF's Department of Computer and Information Science and Engineering, Dr. Locke oversees an interdisciplinary team exploring the frontiers of using virtual reality, artificial intelligence, and related technologies to enhance training and education. He's led the development of cutting-edge virtual patient simulations, clinical communication tools, and other immersive learning experiences tailor-made for healthcare fields. An entrepreneur as well, Locke previously co-founded the company Shadow Health to commercialize virtual patient solutions. With an extensive publication record and multiple Best Paper awards, he's considered a leader in furthering virtual environments for teaching, especially in medical disciplines. Under his guidance, the University of Florida's Virtual Experiences Research Group continues breaking new ground in harnessing emerging technologies' educational potential. Virtual People Factory. Virtual People Factory, VPF, emerged from a University of Florida research lab led by Dr. Benjamin Locke as an early platform for authoring simulated clinical experiences with conversational virtual humans. This served as a springboard for the founding of Shadow Health, a company Locke launched to commercialize virtual patient software for nursing education and training based on the initial VPF research. So Virtual People Factory was a pioneering virtual simulation system that enabled the creation of virtual patient encounters to practice interpersonal healthcare skills. This then evolved into the more sophisticated conversation-powered virtual simulations for clinical training offered today by Shadow Health, which grew out of the same academic work on using virtual humans for healthcare education at UF under Dr. Locke. Virtual Patients Group. The Virtual Patients Group, 2010 to 2017, was a pioneering consortium of over 30 researchers from 8 universities, originally founded by Dr. Benjamin Locke's lab at the University of Florida, focused on establishing the efficacy of virtual patient simulations for improving clinical education. For over 9 years they had collaborated to create authoring tools and platforms like Virtual People Factory as well as conduct studies deploying conversational virtual humans across nursing, medicine, and other health disciplines. Their work had progressed virtual patients from an emerging concept to a widely embraced training method now integrated into healthcare programs globally. The Virtual Patients Group spearheaded innovations in realistic virtual clinical experiences to advance health professional preparation through immersive simulated encounters with virtual patients. Shadow Health. Shadow Health is a healthcare simulation technology company that was founded as a startup out of the University of Florida. It develops interactive digital clinical experiences featuring virtual patient scenarios aimed at healthcare education. Shadow Health's conversational AI allows learners like nursing students to engage in realistic patient interviews and assessments to practice core skills. The simulations cover topics from physical exams, history taking, and communication to specialty subjects like mental health. Ultimately acquired by the global information analytics leader Elsevier in 2020, Shadow Health continues working to provide innovative virtual simulation solutions for training healthcare providers and improving outcomes. In conclusion, the University of Florida's Virtual Experiences Research Group, VERG, has been at the forefront of harnessing virtual reality and AI technologies to enhance clinical skills training through simulated patient encounters. Under the visionary leadership of Dr. Benjamin Locke, VERG pioneered platforms like Virtual People Factory and collaborated in groups like the Virtual Patients Consortium to establish the efficacy of virtual patients in health professions education. This research laid the foundation for spin-off ventures like Shadow Health, which commercialized VR patient simulation into a acclaimed training tool now integrated in nursing and medical curricula worldwide. Through over 2 decades of studies and award-winning published work, VERG and its successors have progressed immersive conversational virtual human experiences from an emerging concept to an indispensable staple of modern healthcare training. Their interdisciplinary research across computer science, psychology, and clinical domains continues breaking new ground in realistic VR simulation design and validating its pedagogical impacts on skill development. The expanding adoption of products evolved from Dr. Locke's academic initiatives stands as a testament to the transformative potential of education technologies VERG pioneered. Their success has inspired proliferation of virtual simulation in both preparing future health professionals and advancing clinical best practices through ongoing experiential learning.